Hi, everyone. Welcome. I'm Christine Buckley, the host of the Brain Aneurysm Foundation's 1 in 50 podcast, here to raise awareness and provide education on a disease impacting at minimum 1 in 50 people. So thank you for joining us. All right, here we are again, back for another 1 in 50 podcast. And it's my pleasure to have as our guest Dr. Jared Cooper, who is a neurosurgery and neuroendovascular surgery at White Plains Hospital and brain aneurysm survivor, Janine Durso. So welcome to both of you. Let's just get right into it with Janine. So Janine, can you tell us a little bit about you professionally and what has led you to become the Believist?
Hi, Christine. Yes, thank you so much for having me. It's such a pleasure to be here. I was a creative director at an ad agency in New York City for many years, and it was a really stressful job. And I didn't think I could do anything else as a career. Like, I loved my job, but I also felt like I was really stuck. And then at one point, my cardiologist put a blood pressure monitor on me and for a week. And at the end, when she saw my numbers, she said, "You're going to have a stroke if you don't leave my office and go change your life." And so, long story short, I realized that my beliefs and the stories I was carrying around were what was keeping me stuck. It was all the stories I had about my life and my what was possible for me. It was really not my job. So I became a life coach, and I help women focus on new beliefs, believing new things for their life and making them happen. Hence, the Believist was born. So that's how I came to do that. And as I credit my my beliefs with actually helping me heal from my aneurysm, because I don't think I had this mindset that I have now back in 2018 when my doctor said those words to me. So I've come a long way in both worlds, my belief and my healing. So,
well, thank you for that. I think that's amazing, and I can only imagine. The next subject we're going to talk about is actually what happened on that day that you had your brain aneurysm. But it seems like the shift you made professionally certainly most likely helped you in your recovery. So can you talk to us, about that day that you learned you had a brain aneurysm?
Absolutely. I was sitting right here at my desk at my home office, and it was a normal Monday, November 2024. And I was coaching a client on Zoom, and I was fine. I had coached a client an hour prior, and it was totally fine. And then 5 minutes into my next coaching call, I had a very sudden, very severe headache, but I knew this wasn't a headache, right? It was just a severe pain. And I called my husband. I hung up with my client, of course, and we were like, I have to take care of this because this is not normal. And I called my husband, who worked about 10 minutes or 15 minutes away. And I said, I think something just broke in my brain, which was the only way I could describe it. It was such an odd feeling and very, very painful. So my husband called 911 as he was racing home. And I remember him asking me if I could open the door downstairs in case 911 got here before he did. And I couldn't do that. I couldn't even do that. I couldn't get down the stairs. And I was suddenly like really disoriented and very nauseous. And so I just stumbled across the hall to our room. And I started to call people on the phone because now I was afraid. Like, I was really scared and I didn't want to be alone. So not that I should do that to a friend, right? But I just was calling someone. So I ended up getting in touch with my brother, one of my older brothers, Frank, and he was away at the time. He was in like Puerto Rico or the Dominican. So he was like helpless, but he really calmed me down. And all I remember saying to him was like, I feel like I'm dying. I don't know what's happening here, but don't let me die. Like, please don't let me die. I was just pleading with him. I was getting sick, physically ill. And I was on the floor basically of my room, just kind of like kneeling down. And I say this because my hands were on the floor, but I was kind of kneeling down and the phone was next to me. So I was talking to him, but with this, I know my husband called me back as he was racing home and I didn't answer. I couldn't answer the phone because my hands would not move. I couldn't move anything. I couldn't move my body. My hands felt like cement. And it was just frightening. So a few minutes later, my husband burst through the door, hangs up with my brother, and he picked me up and put me on the bed. But literally in that few seconds between like picking me up and putting me on the bed, I don't know if I went unconscious, but that's the last thing I remember is him just picking me up. But in the few weeks later, we were piecing it all together because I didn't remember anything for a while. So I was like, what happened? Like what happened that day, And he said, you don't remember the 6 EMTs coming into our room? And I was like, no. And he said, do you remember what you were saying? And I said, no. He said, you just kept repeating, not today, Jesus, not today, Jesus. He said, as if you were talking to him. And I was like, well, that makes sense. That makes sense. I was just, making deals, you know what I mean? Like pleading for my life. So yeah, I guess he listened because I'm here. And they took me to the closest hospital. They did a scan and they couldn't handle my case, which is what led me to being taken to White Plains Hospital and meeting Dr. Cooper.
Well, that's amazing. The sequence of events is certainly very scary. And fortunately, you did have people that were able to get to you. And I think what you yelled out was pretty good, for sure. Like you said, you are still here. But I do think it does become fortunate when you don't remember every aspect of everything that happened to you.
Right.
Now, had you had any prior symptoms or family history?
My dad passed away of a stroke a long time ago, like 35 years ago. But it wasn't an aneurysm. And right before this, I didn't really have any signs. I mean, my client and I who were on the call, like right before the call before this happened, we looked back at our recording a few months later and I was like, did anything seem weird? Did anything seem odd? She was like, no, we both agreed. There was no sign right beforehand. This was very sudden. And it just came on. And I didn't feel anything before that. So it was really a shock.
When you were told you had a brain aneurysm, what was that like? And had you ever heard the term before?
I was really shocked. I don't remember the point that I was told that, but I remember being really surprised. I didn't have any other experience with a brain aneurysm except for somebody when I was, a teenager. Their mom had one and she died, on the scene. So I didn't have very good awareness of a brain aneurysm. It wasn't something I thought you lived through. I never heard of someone having a rupture and surviving. So, and this was not on my radar at all. Even as it was happening to me, I didn't have any idea that that's what was happening.
Well, it's fortunate that you were then taken to a facility that could treat you at White Plains and be connected with Dr. Cooper. So Dr. Cooper, can you tell us like how you first came in contact with Janine and, what her aneurysm was like and just, kind of what happened and what was the reaction to when she came to you at the hospital?
Yeah, sure. I think one thing that I want to stress is how interesting it's been to get to know my patients and their stories. I mean, listening to Janine's story, it's always, somewhat fascinating as a clinician to hear what a patient is going through and experiencing in the moments before they get to the hospital, because we don't always hear that. I'm sure we'll get to it at some point in the conversation, but the support group and starting that at White Plains has really given me a tremendous amount of insight into the background that patients have before we meet them, and then long after we meet them. And that's been really incredible as a provider to help me kind of learn how to cater to my patients better. But yeah, I remember very well meeting Janine for the first time. I got a phone call from one of our sister hospitals saying that there was a patient who showed up with a headache and they had gotten a CAT scan and it showed subarachnoid hemorrhage. And they said, listen, we don't have any neurosurgeons here. We need to transfer her out. And can you take her to your hospital? And so that's what we did. We had her transferred over. She was at our hospital within the hour. And we got another CAT scan to evaluate the brain and how things had changed since she got her original scan. And we got a CT angiogram, which is a CAT scan with contrast dye to look at the blood vessels. and it showed an aneurysm on the coming off of the left internal carotid artery at a branch point with a blood vessel called the anterior carotid artery. And the aneurysm looked small, but it certainly looked like the culprit for her bleed. And I remember meeting you and talking to you, and you were awake, but you seemed overwhelmed with what was going on, right? There was a confusing amount, component to this where, you knew something was wrong, which I could tell, but you were kind of in and out of consciousness and afraid, unfortunately, right? Which is something that we see quite a bit, right? Because when you hear that you have an aneurysm, that alone is enough to make somebody feel so overwhelmed with the what ifs. So I spoke to your husband about your condition and what I thought we needed to do. Because we were concerned about the grade of your hemorrhage and your kind of waxing and waning mental status. We ended up putting in something called an external ventricular drain, which is a small catheter that goes into the ventricular system of the brain to help us measure intracranial pressure and also divert cerebrospinal fluid to treat high intracranial pressure. And then we did a catheter angiogram to better evaluate the blood vessels of the brain and the aneurysm. And you had a almost 4.5 millimeter aneurysm of the anterior carotid artery on the left side that fortunately we were able to treat using endovascular treatment coils. And that was your first day in the hospital.
And I remember none of it.
It was a long day for us.
That is a blessing.
Right.
One of the interesting things that you brought up, at one of our meetings, and I keep this in mind, and I've actually told this story before, and I've used it as an example for other patients and families, is that you and your husband lived very different experiences throughout your hospitalization. And in that way, you both kind of suffered through this traumatic experience in very different ways. And that's part of why this foundation I found is really special, because it caters to both the patient and their caregiver as people in need. And that's something I've learned is seriously important in this particular patient population.
Oh, absolutely. And I think that, as traumatizing as it was for me, to your point, it was traumatizing for my family, for my friends, especially my husband and my daughter, who's 12. And so, it took me a while to really wrap my head around that perspective too. But I remember one night just like laying in bed and thinking about him, my husband, coming home without me that day and like not knowing what was going to be the next day. Like, was I going to make it through the night? And I know there were probably 8 to 14 days where, as I say, I was on the tightrope between here and heaven, and you don't know what's going to happen. So I think that that's such a traumatizing thing for everyone involved. And I had to really understand his perspective, and which helps also to just have that empathy, right, for the caregivers, because it's not just the patient going through this, and it's a really scary event for everyone.
Yeah, I mean, this is the 1 in 50 podcast, but something that we say to people wherever we are talking about this, Capitol Hill, wherever, the 1 in 50 is a number that we can safely share based on data, but we feel it's very conservative. But even going with that 1 in 50, that one is the patient. It isn't the family, the community, the workplace. So people think, that one person having it has that tight circle around them. And it is many, many more people. And it is terrible for families when this happens so suddenly, because there is a fortunate time where you didn't remember, you didn't know what's going on. So here's your husband and your daughter and other close people probably also hearing brain aneurysm for the first time and just not understanding and wanting to help, and just, being so frightened for you and for themselves going forward. So, that's why having information like this and sharing these podcasts. It's just for people to understand that this disease is much more prevalent. And what we always like to tell people, it's very treatable. So hopefully there will be someday either a screening protocol or that blood test to help, detect a biomarker, so more people can find out ahead of rupture that they have it and get it treated safely. Now, Dr. Cooper, I was just wondering if you could touch upon the signs, symptoms, and risk factors in general of a brain aneurysm and what people should know to look out for. And, many times people say they didn't have signs and symptoms, but there are people we talk to kind of after the fact that was like, the week before I kind of had blurry vision or some ringing in my ears, and they just didn't put all the pieces together.
Yeah, sure. I could definitely touch on that. So I think it's important to make a distinguishment between aneurysms that have bled and aneurysms that haven't bled. Aneurysms that haven't bled tend mostly to not cause symptoms. Interestingly, I see a lot of patients that come to my office who have had an incidental aneurysm discovered during workup of something else. And even by the time they get to my office, they still are not under that impression that, oh, this was found accidentally and is not the cause of my mild headache or my dizziness, right? And so I think it's important to distinguish that. Really, unless aneurysms are rather large or pushing on important structures of the brains, like a cranial nerve, they're often asymptomatic. And a lot of people are walking around with brain aneurysms that they don't know about. And I think that that's part of the reason why we have such limited data on who has aneurysms and why or who we should screen. It's because we don't know about the patients who are living and walking around with aneurysms that haven't been imaged. But in terms of symptoms from an aneurysm rupture, classically, the most common symptom is a sudden onset severe headache. It's described as a thunderclap headache or the worst headache of your life. That's usually the key trigger phrase that will or should get people thinking, okay, maybe this person is having some sort of intracranial event. But the way that I try to distinguish this from, the common headache is it's usually accompanied by something else. There's usually the headache plus something like neck pain, nausea, vomiting, altered mental status or confusion, altered speech, or some sort of weakness or sensory disturbance in your extremities. And it could extend far beyond that, but those are the types of neurological symptoms that cluster of findings is very characteristic of an aneurysm rupture. When it comes to somebody going to the hospital, though, and to your point saying, maybe I should have come earlier, I had these subtle symptoms. Sometimes patients can have what's called a sentinel headache or a sentinel bleed, which is almost like a warning sign that there's an impending rupture about to happen with a brain aneurysm. Unfortunately, those symptoms can be somewhat subtle, and they might include a headache, but it's not quite as severe, or include some sort of nausea, vomiting, neck pain, or brief lapse in consciousness. But it's a one-time event and then improves. And it's hard to really distinguish whether or not that's something concerning or just a common headache, right? But what I often tell people is if something seems concerning to you or out of the norm, that's when you should really seek, care at either an urgent care or an ER, just to make sure that you're not wrong.
Thank you for that. Janine, I know giving back is something that's very important to you. Can you speak a little bit to that and how you've become involved with the foundation and getting a support group going out to the hospital you were treated?
Sure. Yeah. Giving back is important to me in all areas of my life. So this was really interesting to be part of the Brain Aneurysm Foundation. But I learned about the BAF from Dr. Cooper, and then I looked the foundation up on Facebook and Instagram and the website, and found so much great information there that helped me understand better what I was going through and what my family is going through. So that was really helpful. And since then, I just wanted to learn more from the foundation. So as soon as I found the walk, I learned that there was a New York City 5K. I was definitely all in for that. So I did that. That was 10 months after the rupture. And when I was recovering in rehab, I needed to figure out how to walk again because I really couldn't after 5 weeks in intensive care. So doing that so soon, if you will, after the rupture was a huge milestone for me. I had great support from my family and friends, and we were able to raise over $10,000, which blew me away. Like it really was, sharing this information and the signs and symptoms and my story with social media, my email list, like all things like that, really blew me away with the support. And so that I know will go to such a great cause here. So that's great. And then the support group that the Brain Aneurysm Foundation and Dr. Cooper run at White Plains Hospital has been fantastic and so necessary for me to meet. It was the first time I spoke to a person and their caregivers who survived a ruptured aneurysm. And that was so meaningful to me because I had joined some support groups online on Facebook and mostly. And, it's interesting to hear their stories too. There's something just different, right? Like those are impactful and I learned so much. I'm inspired by people, but to see people live in person and hear their stories and meet their families was just really inspiring to me and very supportive, like just to know that people are going through the same thing. So that was really important because sometimes it can feel lonely, like people don't really know what you've been through. And that is the place where I know people really know what we've been through. So that's important. And it just adds another level of understanding to everyone in the room. And I love how we all just come together and Dr. Cooper and his team do such a great job at educating and also making a safe space for people to really open their hearts to what's happening.
Well, that's great. We appreciate the efforts and time that you've put into getting that off to the ground with Dr. Cooper in the hospital, because 30 years ago, that's sort of the main reason this foundation started, was to provide that support, because people just really don't realize coming out of it in recovery what just happened, what to expect moving forward. And people need that opportunity to share. And I some people combine it with stroke, and if that is the way it has to be for resources and time, that's great. But I really feel that the brain aneurysm journey and experience is very unique. So to give people that opportunity, specifically going back to where they were treated, is just really so valuable, again, for the caregivers as well as the patient. And something that the foundation is really going to focus on in 2026 and moving out is to make sure that there is a support group in receipt location. We've had many, there used to be many more in the past, and after COVID, some have fallen off. So that's something that we're really going to try to do because, again, it's just so important for people to come together and share that community and to, like you said, to feel safe and be able to say what you need to say, and also have the proper education and people overseeing it so that you know that you're learning and sharing together. So really appreciate all that you have done to be a part of that and be part of the community and the walk. And another thing I tell so many people who don't know how to jump in initially and, be part of the organization and help, the easiest thing is follow us on social media and share, because you don't know who you're going to reach with this information at a time that they need it. And it's somebody that we don't know. So the more tentacles we have out there in social media, for sure, the better. And Dr. Cooper, I just want to say, you've touched upon it a little bit, but how important is it for you in the hospital to really give back more to your patients in terms of that continuum of care? Because so many people treat patients, they send them out and that's it. But now, meeting Janine, I think getting the support group going, using us as a resource, how is that different from what you had been doing in the past?
I've said this before, probably to you offline, Christine. Starting the support group at the hospital has been one of the most fulfilling experiences of my career. I like to try to make a connection with my patients when I see them in the hospital, because I try to, I've been a patient before, right? And I understand that there's an emotional component that isn't always addressed. And so I try to touch on that when I meet somebody new and spend time explaining what's happening. But in the setting of a rupture where there's so much new information and it's so overwhelming and it feels so serious. It's hard to, internalize and really understand all of the information that's being thrown at you. And I think, the foundation or the support group has really given patients an opportunity to catch up on some of that information and really understand what happened to them or what is going on. Same with the caregivers. But watching patients feel comfortable sharing their story amongst peers in a safe place and bonding with each other has been just a tremendous experience for me as a provider. And it's been so incredibly insightful to get an understanding for me of what people are going through or have gone through. And it's definitely helped shape my practice as a provider because I'm even more in tune with what is probably going on through a patient or their caregiver's minds when we first say, hey, listen, there's bleeding on the CAT scan and we think there's ruptured aneurysm. It's really been a tremendous experience. And Janine has been like our big advocate, and she's always encouraging people to try to come out of their shell a bit and share. And it's been a wonderful experience. I've seen patients really connect with each other. Importantly, also just to make mention, it's not always it's not just for patients who have had a ruptured aneurysm. It's for patients with unruptured aneurysms also, which in and of itself is, can be a very disabling or scary thing, right? A lot of patients consider this a ticking time bomb, even though they may have been told, listen, it's small, or you have few risk factors and this doesn't necessarily need treatment, or maybe it does, but we don't need to treat it right now for whatever reason. That can feel very scary, and it can feel very isolating when you're in your own space in public and you don't know anybody who's going through the same thing. Not to get into too many details, but Janine, I don't know if you remember from one of our prior visits, we had essentially two patients who both had unruptured aneurysms, very similar in their size and location. One was just diagnosed and one had had that aneurysm for 9 or 10 years. Mm-hmm. And it was very interesting hearing the interaction between the two of them about how they're coping and how they manage things like a common headache because these things can be very scary for somebody who thinks that every time they have a headache, they're going to die. And so, it's been a really insightful and educational experience for our patients, but also for us as providers.
That's great. Thank you. And I'm glad you did mention it's just as important for those that are unruptured and have been diagnosed, because that's a tough thing to carry around with you, particularly the more you delve into, the disease and the more information you get. And there are no guarantees of, when one might rupture or they're not. So we've definitely learned from many people that can be very, very challenging, just going about their daily life. And then, like you said, just a little headache here and there. And is this it? So, it's definitely for anyone that has one treated, waiting for treatment, and for the caregivers as well. But again, thank you. I mean, Dr. Cooper, you're very unique in the time and energy and seeing how fulfilling this is from the physician standpoint. So I do want to thank you for, diving right in and supporting your patients this way. They're really very, very lucky.
Well, thank you for supporting us.
Yeah, our pleasure. Janine, I want to ask you, what would be 3 things you would recommend for patients and families, once they are, just starting their recovery journey? And I'm sure a lot of this comes up in the support group. So what are the 3 things you would caution people of, or just want them to know as they get going?
Sure. I have 4 because I'm, can't keep my mouth shut. But one
even better.
But one Dr. Cooper just talked about, and that is that it's normal to have anxiety, whether that's a re-rupture or if you have an unruptured aneurysm. It's totally normal to feel that. And I know that we were just talking about that other meeting where there are 2 different people who experience it very differently. But one of the things I just want to say is that it's normal to have that, but try not to let it keep you from living your life, because we are, we're lucky to be here living a life. It might look different than before, but get the help that you need to help with the anxiety part of it. That was number one. Number two is just like, take your time, and don't get discouraged. We're practicing new ways of being, and we're also building new pathways in our brain to do things either the way we did them before or in a new way. And that takes time. So I just want people to have grace with themselves. And this, I'm also telling myself this too. Third is, I want to just have, we talked about this already, but like, get support in person if you can. Have your village, know who they are, and join a support group in person, because it's really important and it adds another dimension to your healing and processing. And the last thing I would say is that what you believe about yourself and what's possible is literally everything. As I say, like, if this had happened to me 7 years ago, I wouldn't have had the same beliefs I have now. And I really feel like I credit my mindset to helping me heal so much. And so your life might be different from what it used to be, but there is a new path forward, and know that it's a new path forward, and believe that it can also be good. So.
Yeah, that's beautiful. Thank you. And I agree. It's patience and time and gentleness to yourself, and finding, like you said, the new road forward. And things may never be exactly the same, but you accommodate and you learn new things, and, you're here, and that's most important. You have your family, they have the people that you love to continue making memories with. And I think that's what matters the most. So in closing, is there anything either of you want to say that's important for people to know?
I think for patients to understand that they're not alone is really important. Like I had mentioned earlier, this can feel like a very isolating diagnosis or problem to have for both patients and their families, right? Feeling like you're alone can be very disabling. And, I've learned through working with this foundation and through starting the support group at our hospital that the sense of community is incredible for the healing process. And use the Brain Aneurysm Foundation as a resource. Use your hospital and local support network as a resource. I've seen patients come an incredibly long way from believing in themselves and from feeling a sense of community with other survivors and their families. And I think Brain Aneurysm Foundation has been just an incredible resource. It gives a voice to people without a platform and gives a community to people who feel alone. And it's incredibly special.
Absolutely. And I just wanted to say that I want to continue to raise awareness and the signs, the symptoms, and just let this be one of those topics that we talk about every day. We have everyday awareness over, like breast cancer, like other diseases and conditions out there. So being part of the Brain Aneurysm Foundation and being able to share your information to help raise that awareness and save lives is not only an honor for me to do, but I feel like, having been through this, it is my responsibility now. And so that helping one person know and get help before, as it bursts, or before it gets screened or whatever, raise money for research, like that's definitely what I feel like is my responsibility now.
Well, I appreciate you having that outlook and doing what you are doing, because it's hard. It's hard. People are different, and that you have the ability to come out like you are, to jump right into this role of feeling the sense of responsibility. I want to thank you for that, because the awareness and education is key. And again, when you have something happen so suddenly and tragic like this, and you've never even heard about it before, it just doubles down on the angst and pain for everybody. So if we can get the awareness level to heart attack and stroke and increase, early detection that there are fewer ruptures every year till they're none. And again, the treatments keep getting better and better. So why not let's treat people before they rupture? So I thank you for sharing and being such a wonderful advocate and ambassador for the cause. And I want you to know it does make a difference, right? And you are making people feel better and they're seeing what you're doing. And it isn't easy, right? It took time and it's taken steps and it's a continual journey. But thank you, and for what you have done and what you continue to do. And thank you, Dr. Cooper, again, for so generously giving of your time and seeing the value in giving back to supporting the patients and families that come your way.
Thank you. Yeah. And thank you for making yourself available to us and for providing this just, really unique and special resource for our patients and their families. It's truly a special thing.